Hi, I'm Dr. Sandra Lemansky. I'm an optometrist at Parmer Eye Care in Austin, Texas. And I wanted to address a question that we get from our patients from time to time about what exactly is a contact lens fitting. We've done the exam, we've written a prescription for glasses, and now the patient is like, well, I'd like to get some contacts. Can you just write me another prescription for the contacts? Well, there's a little bit more to it than that. And some of that more to it is actually kind of just going on in the mind of the doctor as we're evaluating the patient's refractive error and their health of their eyes and things like that. But the contact lens fitting is generally the service that the doctor provides to determine the type of contacts that are going to work best for that patient. And maybe we've already been seeing that patient for years and we've been fitting them in contacts, and they think, what happens with this? Every year I come in here, you charge me this fee, and then you just hand me some contacts and we're good. But there really is more to it than that, even on a returning patient. So the time that the doctor spends reviewing and discussing with you any changes in your prescription and the health of your eyes is the first thing that we would think of in the contact fit. So the doctor's thinking, okay, did the power change? Did this patient become more nearsighted, more farsighted, less so? And have they developed astigmatism? Because astigmatism is something that requires a special type of contact. And sometimes the patient may have just a little bit of astigmatism, and it's not enough that we need to worry about correcting it in the contacts. But then if it kind of crosses over this one line, then we say, okay, now it's not just that we need to change the power of your contacts, it's that you need a whole different type of contact to get your vision clear. It's not going to work to just use the same ones that you've been wearing because now you've got this astigmatism. So now we have to go to a special type of lens called a toric lens. So that's one thing that we're thinking about when the patient comes up with, hey, I'd like to get some more contacts. Also, a change that happens in our eyes over time is the ability to shift focus from distance to near. So as that starts to occur and change, we may have to change how we're fitting the contacts. They may have come in and thought, these contacts are fine, I just can't see up close, so can you just fix them so I can see up close, then we'll be good. Well, if I fix them so you can see up close, you may not be able to see far away. So we may have to talk about different options as those changes have happened. So we may be looking at still fitting you in the same type of contacts that are correcting your distance vision, but maybe now we need to do some reading glasses over them. Maybe you can just get some over-the-counter reading glasses, or maybe there's some reason that we want to do a prescription pair of reading glasses. And to be honest, a lot of times there's the equivalent power in an over-the-counter reading glasses, but we may be able to make you see more clearly with a prescription pair because it's going to have the anti-reflective coating on it. There's going to be better optics in the lenses than what you get in those over-the-counter glasses. You can get the blue light protection if they're for computer use and all that kind of stuff. So this is all discussions, or at least things that are going through the doctor's mind as the patient is saying, hey, I want to get some more contacts. So whenever that change in the vision starts to occur with the near vision, then we have basically three options that we need to discuss in most cases. One would be continuing to fit you in the same type of contacts and put reading glasses on over them. Another option is multifocal contacts. And these days, most patients are able to be a candidate for multifocal contacts, even in the one-day disposable type. So that's usually a really good option as that starts to happen. But sometimes patients are not a candidate for that type of lens. So then we need to talk about something called monovision, where we would correct one eye for distance and the other one for near. And this can sometimes be a long conversation. They just ask the question, can I get some more contacts? But now we may launch into this whole nother discussion about how their eyes have changed. Also, we need to make sure that their eyes are healthy enough to wear contacts. We need to look with the microscope and see if there's any signs of contact lens intolerance on the cornea, or inflammation, or are there some little blood vessels growing into the cornea that might indicate their eyes have not been getting enough oxygen with the lenses that they've been wearing, or are their eyes getting drier? We tend to have more dryness turn up as we get older, especially females, because as we go through hormonal changes, dryness becomes more of an issue. So sometimes those same lenses that were working before may not work anymore. We might need to change to a different type, or we may need to do some treatment for dry eyes. So again, this is something that's kind of going on in the background as we're having this discussion. Also, we need to have a discussion about, are you compliant on the wearing schedule? So, are you in the right modality for your lifestyle? And this may trigger a discussion on your computer use, your outdoor activities, whether you travel a lot, do you fly, do you want to do daily contacts so you don't have to bring a big bottle of solution along with you that doesn't even fit in that Ziploc they let you have. So these are all, again, things that are part of the doctor time spent reviewing and discussing with you any changes or the health of your eyes and whether the contacts are going to be the same or whether we need to make some changes. Second thing that the fitting includes, at least in our office, is a set of trial contacts, usually about a 1 or 2 week supply. If we're doing dailies, they come in little 5 lens strips, so we're probably going to have hopefully a 5-day supply of them here in the office. We may have to order to give you a whole 10-day supply, but it's going to include some trial lenses so that you can wear the contacts in your normal activities and make sure that they're working for you. This is going to include the staff time that's spent either pulling the lenses or ordering the lenses and then calling you and letting you know they've arrived and scheduling a pickup time. So again, staff time working on fitting you in the contacts. The third thing that it includes is a follow-up in our office about a month from the time of the exam is included. So that means that follow-up may be as simple as you giving us a phone call to let us know that the trials we gave you are working, you're happy with them, okay, great, we'll finalize them, you can get your boxes ordered. But that follow-up might not include just a simple phone call. It may be an office visit to verify the fit of the lenses and that your vision is distance and near is optimized. And in the case of toric lenses or multifocal lenses, then it may take more than one set of trial lenses, may need some more follow-up visits. Sometimes 2 or 3 visits to the office are needed. Sometimes the first set of contacts that we give you, the trials don't work for you, so we have to bring you in, figure out what's not working, give you something else, let you wear those for a while. This is all included as part of the fitting of contacts. And then sometimes during the follow-up period, you may decide that this type of lenses that we started are not the ones that are for you. Maybe toric lenses are not comfortable and you want to go back to your regular lenses even though you may not see quite as well. Or perhaps you want to switch to daily from monthly or vice versa. Perhaps wearing reading glasses over the contacts is more of a hassle than you realize and you want to look at multifocal lenses after all. So these are all things that can pop up during that month of follow-up time in the fitting of the lenses. And then the fourth thing is we as doctors, we're not just educated. Yes, we went to optometry school. We've got some extra years and figured out how to do this stuff, but we're also licensed to fit contacts. And because of these, we have to adhere to the standards of care, and we're legally responsible to make sure to the best of our ability that your eyes are healthy enough to wear contacts and that the lenses that we fit you in are not likely to cause problems, and that you understand the importance of compliance and how to comply with lens wearing habits. So we have to pay for insurance to protect our ability to do this and our license to practice. So these are all the things that, you may not realize what all is involved in just a refit in lenses. And for those patients who are getting contacts for the first time, of course, there's a little bit more education needed because we need to bring them in to sit down with our techs so the techs can teach them how to put them on and take them off and take care of them. And there may be a little more discussion about what wearing contact lenses looks like in the exam room. So there's a lot of decision making going on kind of behind the scenes and some staff time that's going on behind the scenes, as well as just expenses of running a contact lens practice. So I wanted to kind of explain that, let you know why that is, that there is that little additional item when you wear contacts of that contact lens fitting. And I hope to see you soon if you want to be getting some new contacts. Thank you.